We're live. Hey, everybody. It is Mike Banner, and it is time for 62 Who Knew here Monday night at We Beam TV Studios in Port Richey, Florida. And we thank you for being here. Tonight we have a fantastic guest that was supposed to be here just a couple of weeks ago. We had some issues, and we couldn't do it, so we played a repeat. And last week was Memorial Day, so we had to play another repeat. First time we ever did 2 repeats in a row, but we are back tonight. You're going to enjoy this show. The topic tonight is Medicare, and I think more than any topic that we've ever covered in 41 weeks. Yes, this is our 41st show. This touches everybody. You can't get away from this. Well, unless you die before you're 65, and who wants to do that? I mean, really and truly. So let's hope this becomes a topic in your life. We always start, as we know, by thanking our guest, which in this case was 3 weeks ago, and that was Johnny Lowy, wasn't it?
Was it? I think so.
Yes.
Yeah.
And we had a ball with Johnny, one of the best real estate recruiters and trainers in North America. We had a ball with him and talking about his company that he's growing throughout the country, Align Right Real Estate. Thank you, Johnny, for everything you do for us. And we always also start with a synopsis of what 62 Who Knew is really about. And by the way, slowly but surely, we are morphing 62 Who Knew into 62 Who Knew, the Longevity Initiative. Because really everything we talk about on this show is about longevity. This is the premise of the show. The name 62 Who Knew, which we enjoy a lot, but may not be as good as the Longevity Initiative. I still like 62 Who Knew. It rhymes, and it's very hard to find something that rhymes with initiative. So we're gonna, it's very hard. But the truth of the matter is, when you get to 62, really and truly, most people who knew you still have about another 30 years left in your life. This is something that is unique to our generation meaning the baby boomers. I'm going to be 61 in a few months, and I say this all the time in my public speaking, when I'm speaking about reverse mortgages or promoting 62 Who Knew. Everybody, when they approach retirement, when they approach that age of 62, our father, their fathers pretty much had the same questions. Did I save enough money? How long am I going to be retired? Where am I going to live? Should I have long-term care insurance? Should I have canceled my life insurance? Should I keep my life insurance? The questions are always the same, generation after generation, when we approach retirement. Should I have a mortgage? Should I struggle to pay it off? Should I put my money in annuities or the stock market? Nothing changes. But for our generation, the baby boomer generation, where 10,000 people a day in this country for the next 18 years are turning 62 years old. Let that sink in. For the next 18 years, 10,000 people a day. America is coming of age. And those people have an obstacle or a bump in the road that no previous generation did. And that is longer lifespans, longevity. Over the last 2 to 3 decades, medical breakthroughs, modern science, technology, a whole plethora of things has just expanded our lives like never before. So where our fathers and grandfathers and their fathers may had to plan when they reached 62 for the next 10 years or 15 or 20, today's person approaching 62 has to plan for close to 30 years. That's almost half the time they've been here. Thus the name, 62 Who Knew? So without further ado, that's what we're about. Our audience is growing every week. When we had our live show with Johnny, and the week before with Laura Banner, where we talked about dementia, which was a very, very serious show. Both those shows were above 24,000 viewers. We broke a record those 2 weeks, but I have a feeling we're going to break the record today again. So first we say hello to Nada.
Hello.
The co-hostess with the mostest, the Puerto Rican princess. Yes, she's here. She spent the weekend at the beach. You can tell by the complexion. One of us is in the office working. The other one's at the beach. Can you tell which one? Can you tell which one?
I just bake.
Yeah.
If it's hot out, I get tan.
And absolutely, I am so excited to have this lady. You have no idea. We met approximately 5 weeks ago. Ms. Diane Daniels, the founder of Medicare Nation, the host of Medicare Nation podcast. And let's face it, this, like Social Security, this is part of our life. I mean, and it's amazing how many people don't know about it, or don't know, or like reverse mortgages, think they know about it, but
Yes,
they
they
don't.
think.
But I start out with one question with every guest, whether it's an attorney or a specialist like you or a health person, and that is, because I know your background, this fantastic lady was a police officer for how many years?
Too many.
Yeah, for many years. Yeah.
24.
24 years, and we thank you so much for, there is nothing better than a law enforcement agent. I'm from the old-fashioned school where you respect the badge
Well, thank
and the man and the woman. No, thank you for protecting and serving. You are our everyday superheroes, and I like superheroes.
I like superheroes.
But what brought you from law enforcement to creating Medicare Nation? That's always my first question. What brought you to where you are today?
Well, it's really interesting. So when you're 49 years old and you're retiring from a job, okay,
Right.
that's a little young. So
Yeah.
you still need to be working. So I've been a civil servant my whole life. I mean, I was an EMT when I was 18 years old. And I worked for New York City EMS in Manhattan, the greatest job I ever had, ever will have. It was awesome. And after that, I wasn't really making enough money because they didn't pay back then equal pay for emergency medical technicians and paramedics compared to firemen and the police officers. So we got paid less, a lot less. And it was very hard to get promoted. And I said, all right, well, what am I going to do now? Am I going to be a fireman, a police officer? Do I want to, struggle with that,
Yeah.
right, with the friggin' mask?
That wasn't Darth Vader. That
was not Darth Vader.
That was a fireman, by the way.
It was a
and
fireman.
it was a very good
Thank you.
fireman
Thank you.
and a very good Darth Vader at the same time.
I appreciate it.
Or
Put that
Darth
on the
Nader.
Nerd Show.
Or
Put that
Darth
on the Nerd
Nader, as
Show.
we have here. Yes.
Or do I want to run around with a gun, which I had never even
Oh, yeah, let's
held
do that.
before?
Yeah.
With the bad guys, I was like, yeah, I can't handle that claustrophobic stuff. So that's when I decided to become a police officer. And after that, you spend your whole life helping people, all right,
absolutely.
and trying to get your butt home every night. You don't think about another career. So when it's coming towards the end, I'm like, what the hell am I going to do? I'm only 49. Everybody's like, go into insurance. It's easy. Go into insurance. I'm like, oh, my God. So I said, all right. And I got licensed, and I started, I'm going to tell you, I frickin' hated it. I hated it, all right? Who the hell really likes insurance? Do you like insurance? We don't like insurance. I used to go to parties and tell people, yeah, I'm an insurance agent. They'd be like, nice to meet you. I'm out of here. Exactly.
They're putting up the cross.
I know. They're putting dread.
Second to the dentist.
So, I don't know. I think they like that better than me.
Yeah.
So I wanted to get out. And one day I was in a call center, and the manager came in and said, Jane, if you know anything about Medicare? And we were like, it's for old people. I mean, really, what did we know about it, right? And they were like, well, we're going to be offering Medicare products. We need people to go for training. I was like, at that point where I was sick of what I was doing. I didn't like it. I was like, I'm out of here. I'll go to training. So I went for the training. It was hard, so I was excited, and I went through it all, got certified. I went on my first appointment. I met a 70-year-old woman. And when I rang that doorbell and she opened it, the biggest smile is on her face, and she's literally pulling me into the home. I'm so glad you're here. You have to help me with my Medicare. Well, I'm brand spanking new. I hardly know anything myself. But I went through everything verbatim with her, and we talked, and I helped her understand what she needed to. And by the end of the appointment, she was like, I want that plan that you're offering. I was like, that was the easiest thing I've ever done in my life. But I kept going on some appointments, and I noticed people didn't understand Medicare. I said, something's going on here. Why don't people understand Medicare? And I saw the need for the education. And I said, I love this. And so I said, I'm going to learn everything I can from this frickin' company, and I'm out of here. Because all they cared about was quotas, okay, and selling. That's just not me. I just spent my whole life, over 35 years helping people. So I learned what I need to learn. I got out. And I started my own business, and I've never looked back.
What a fantastic story. Yeah. And you're still protecting and serving. And nobody's shooting at you.
It's true.
And nobody's shooting at you.
Not today. Not today. Nobody's shooting at me.
Yeah. Well, that's a fantastic story.
Yeah.
Well, I know you have thousands and thousands of downloads of your podcast. I'm just entering the podcast world myself, and we're going to publish the the link because you were nice enough to let me be a guest
Yes,
on the
he
first
was. He did a
podcast.
fantastic job. You're
Yeah,
going
thank
to
you.
enjoy the episode immensely.
Thank you, and I have the body for podcasting, so this is really.
Me too. Believe me, I'm right
made
with you.
for
I'm
made
right
for
there.
audio. Let me tell you. But with all those thousands of downloads and all the people that you visit and talk with and help throughout the country, what do you see as the number one thing that people should know about Medicare but don't?
The number one thing, without a doubt, 20 billion zillion %, is that Medicare does not cover everything. Okay? It does not. That is such a very sad myth. If all of you thought that, I'm sorry, it doesn't. Okay, there are many things that Medicare does not cover. It's an awesome program. I love Medicare. I think it is the absolute best healthcare system we have. I love it. But it doesn't cover everything, and people get very surprised when all of a sudden things come up and they're like, Medicare doesn't cover that?
Yeah.
So that is the number one problem.
Yeah, there's no doubt. We run into that in our reverse mortgage world a
Absolutely.
lot, even though we don't sell insurance when we're doing a reverse mortgage. But I hear so many people when I say to them, do you have long-term care insurance? Do you have a med sup policy? I'm not selling that. I'm not even licensed.
Right.
But they're 74 years old. They're my
Right.
reverse mortgage client. I care about them. And they many times their answer is, oh, I have Medicare. Everything's taken care of. And I go, I don't think so. I'm not an expert, but you need to talk to somebody.
Yeah.
So there's no doubt that is.
It is.
Okay, and what would come next? I mean, when somebody who gets Medicare discovers or is educated into, okay, it doesn't cover everything, what's the answer to that?
Well, the next thing a person should really be thinking about is, because what happens to all of us is, because it's a program that's for people that are 65 and older, unless they've been labeled as disabled, okay, or they have kidney failure, okay, Lou Gehrig's disease, things like that, is that they don't have to think about it until they're going to be 65. So we don't think about it.
That's right.
It's not part of my life right now, right? I don't got to worry about it. I got enough on my plate. So when they are 64, and this is you don't even have to worry, because you're going to get inundated with mail. It's just going to start coming from every carrier you could think of, all
Is that
the
kinda
mail.
like the
and phone calls.
AARP
Yeah,
mail?
exactly. All that crap is going to start coming. I'm like, what is all this crap? So you're going to know it's going to be time for Medicaid. They need to do their due diligence. Okay, because there's a lot involved, more than just the original Medicare program. They need to know in their finances. They need to know about their own health and their prescriptions and what doctors they have. There's so many components that are involved. And please don't listen to your neighbor, Phil. All you need is for Phil to come over and say, hey,
Yeah.
you should call my insurance agent because I'm on the best plan. I get $30 worth of free Band-Aids every month, okay?
Yeah.
And I'm going to hook you up with Phil.
Right.
Don't do that.
Yeah.
Okay, because everybody has unique needs,
Yeah.
and there are going to be plans that fit your unique needs. So a lot of due diligence needs to be done before a person gets on Medicare.
Name a few unique things that you could think of as far as
Yeah, so a person that's a diabetic, okay, a type 1 diabetic, a person who's on insulin, okay, that's a chronic disease, and that's very important, okay, and there are certain Medicare Advantage special need plans that are specific for diabetics and medications that they're taking. Then there's also the need to know if they have the finances to have a Medicare supplement, because they see so many doctors, and maybe they are snowbirds and they go from Florida to their home back up north, and they're seeing different types of doctors. Okay, that's a unique situation. We're not, talking about the person who's turning 65, who's a marathon runner, has no health problems whatsoever. They don't take any medication. They don't even take an aspirin. Okay, people that have specific health problems, health issues, they really, really need to check things out prior to making decisions on what type of Medicare plan, or if they're going to stay on original Medicare.
And of course, there are, how many carriers, if you had to guess, or this may be a stupid question?
No stupid question, but Maron. I mean, more coming out every day.
I haven't heard that since I left New York. Maron.
Maron.
What kind of question are you asking me? You should have brought Johnny back.
There are so many carriers.
I thought
really,
it hasn't shrunk like long-term care insurance?
No, it hasn't shrunk. Every day somebody else is foaming at the mouth to get into the Medicare Advantage plan. Oh, jeez. Yeah, there's a lot of carriers.
Why not? There's 10,000 people entering every day.
Yeah, 60,
that makes sense.
Yeah.
No, I guess it does. So,
it does.
So it is complicated out there. To try and do it without a professional seems kind of foolish.
Now, a lot of people think they can. Okay, but there really is not a lot of resources. You can go on the Medicare.gov website, knock yourself out because you'll be freaking looking at that stuff for like hours and hours a day.
Until
and then you're going to go
68.
crazy.
Yeah.
Exactly. You're going to drive yourself crazy because it's not user-friendly. I have to be on that site every day, and I'm like, come on, Medicare.gov, please, you know? So I feel bad for you if you got to go on there and navigate through that mess. So there's really not too many resources.
All right, so there's a lot of there's a lot of options for Medicare. How about options for Medicare supplemental policies, or what you guys in the industry call med
Again,
subs?
even more.
Really?
Yeah, even more. So
I
we're
didn't
going to
know
think about
that.
this way because for Medicare Advantage, okay, that's Part C of Medicare, which stands for choice, okay, and that's a directly part of Medicare.
All these
so
years I didn't know that's what C stood
Yeah,
for.
I didn't know.
Hey, yeah, see, Part C is for choice. So, and they introduced that to offer people a choice between original Medicare or to then have it managed through a private insurer program through a Medicare Advantage plan, right? So they're under all the strict umbrella and rules and regulations under Medicare. A Medicare supplement, okay, is an insurance carrier, but it's not directly part of Medicare, and it's actually an insurance policy you're taking out on yourself. So it's a policy where you're asking the carrier to pay for some or all of your out-of-pocket costs that you would normally pay under Medicare.
And is
Now-
that? Oh, no, go ahead.
Can you have the supplements with the Medicare Advantage and supplements, or is it strictly with Medicare only?
Yeah, you can't have Medicare Advantage and a Medicare supplement together.
You cannot?
No, you
Not
cannot.
even for meds or anything?
No.
No?
So
Oh,
you have original Medicare, the original program that was developed in 1965, and with that you can purchase the policy, that's a Medicare supplement, to supplement, that's where it comes from, the out-of-pocket costs that you would incur with Medicare with deductibles, copays, and coinsurance.
Okay.
Or you enroll in a Medicare Advantage plan, which now manages your health care under the plan, and you follow their network of doctors and facilities. You have certain copays and coinsurances that are fixed that you will see. It's written right there in black and white what you would pay out of pocket up to a maximum amount, and most of them include prescription drugs. If you're on original Medicare and you have a supplement, then most people will then purchase a prescription drug plan to cover their prescription medications under Medicare Part D. D for drugs, right? So that would be the other situation where you'd add that.
So I'm assuming the Medicare plus the supplements is typically more expensive than the Advantage plans.
That's true, okay? Because like I said, you're taking an insurance policy on yourself. And insurance is all about what, Michael?
Risk.
And money, baby.
Yeah, risk and
Got to have a
money.
profit, right?
Yeah.
So it's all about that. So if you're going to take an insurance policy on yourself, you're asking this carrier to pay the out-of-pocket cost for you, okay, for your diagnostics, for your treatment of injuries and illnesses. So you've got to pay them each month to do that. But it is also the biggest peace of mind because you're paying out of pocket for them to pay some or all of your
That's right.
out-of-pocket costs. You can go anywhere in the United States of America and its territories and receive medical care for any doctor or facility that accepts Medicare. You don't have to ask for a referral, and you can go wherever you want. So that is really the peace of mind type of plan for people, so it costs more. Medicare Advantage has a network, so it is smaller. Okay, you must see their doctors and facilities in the network, okay, or else you may have to pay 100% on your own.
Okay.
And so for that inconvenience, the costs are usually cheaper. So in Florida, we're very lucky. Most of the plans under Medicare Advantage have no premium. There are some, but most are no premium.
Right.
So which, in your opinion, is better?
No, there is no better.
So
Because
it's
all
up
that
to the
matters
need.
to me is what's best for you.
Okay,
What
that's very
fits
important.
your unique needs. That's how you have to think about this, people. It's what's going to fit your needs. Okay, there is no such thing as the best
As the
plan.
best one?
No, not at all.
Because I know people that go, this one's the best, this one, and
Yeah,
that
no,
always
no.
worries me, to be
No,
honest with you.
Not at all. Not
It's
at
like
all.
telling us what's the best mortgage. It depends. How quick do you want to pay off
Well,
your
you
house?
see?
When are you
Yeah.
retiring?
There you go.
Yeah, it's the same
Right.
thing.
Yeah, it's the same thing. You have to find what's right for your needs.
Can you come off the Advantage and go on to Medicare in mid-year, or do you have to wait till the end of the year, or are there certain instances, or like say a nursing home, so many days that you could switch from Medicare, the Advantage plan back to Medicare?
That's a very good question. Okay, so with Medicare Advantage, because it's directly part of Medicare, okay, there is a locked-in period. So, and it goes the calendar year from January 1st to December 31st, okay? And if you enroll in that plan, you're locked in unless you have a special exception. An exception would be, I moved from Pasco County to Hillsborough County. So if you move, now you have an exception. You can now look at other Medicare Advantage plans if you'd like, and you could switch. You could go back on to original Medicare, okay, and then you'd be able to purchase a Medicare supplement and try to get on that. Other type of exceptions would be is if you went into a nursing home or an assisted living
That's where
facility.
I was getting at, because I'm dealing with that right now.
All right, well, there you go. If that happens and you're entering into that, that gives you a special election where you can make changes while you're in the facility and even after you come home, 3 months after you come home, you could also change your plan. So those are called special exceptions. There are a multitude of them. So there's a lot of different ways people can make changes during the year. Okay. But if they don't have a special election, then they're locked in until January. And then during the open enrollment from October 15th through December 7th, Pearl Harbor Day. I try to say that so people will remember that. That's the last day. That will go into effect for January 1st. Then Medicare just started in 2019, the Medicare open enrollment from January 1st to March 31st. People can make a one-time change if they felt they made the wrong decision. They could also change their Medicare Advantage plan, but that's only for people on Medicare Advantage plans.
Okay.
It can't be a person on a supplement. It can't be a person on original Medicare with a prescription drug plan. Only for beneficiaries on Medicare Advantage plans.
So they can go from one Advantage plan to another Advantage plan.
That's right.
Okay.
All right, so people get educated. They get their Medicare because they're supposed to. They're financially well off enough to get their Medicare supplemental policy. We have a lot of guests here talking about long-term care insurance. It's I can't say it's a passion of mine since I don't have an insurance license, but I'm close to the industry and I think it's a great product. Like reverse mortgages, I wonder why everybody doesn't have it. Most of the reason is affordability.
That is the most.
But even people that can afford it are very misunderstood. So the next question to me is...
There's some great products now, too.
Yeah, so
Very
the next
great.
question for me is, I have my Medicare, I have my Medicare Sup. That's it. That's all I need for the rest of my life. Or should there be a custom long-term care insurance policy to cover what those two things don't?
Yeah, and that's a great question. So it's been stated, through different analysis now that 7 out of 10 people who are over the age of 65 are going to need some type of long-term type of care. And we're talking about long-term, we're talking about 30 days or more.
Right.
Okay? So Medicare will only cover it, okay, if it's involved in a custodial medical setting. Okay, so skilled nursing facility where you're being treated, okay, for an illness or an injury, 24 hours a day.
So
okay?
that wouldn't be assisted living. That would just be nursing home, correct?
Well, no, nursing home is separate. Okay,
Right,
it's,
right,
yeah,
from
it's
assisted
separate.
living.
Yes,
Yeah.
exactly.
I'm
So if
starting to
it's
learn
not-
those differences, and it's very complicated.
It really is. You're right.
It's
it
very
really is different.
complicated.
So I don't know why. This just seems absolutely diabolical to me that if a person can't eat by themselves, that's not considered a medical problem.
Oh,
But-
I didn't know that.
Yeah, they don't care. Get somebody to feed you. Okay, you can't shower or take a bath yourself. Too bad. Get somebody to help you. That's not a medical problem.
That's
Yeah.
for Medicare.
No, there's.
Or you
That's
just-
what Medicare is saying. That's not
That's what Medicare
medically
is saying.
necessary.
Right, that's what Medicare is
Is that
saying.
amazing?
Yeah.
I mean, it's crazy.
Right.
Government
I
plans,
can't walk. I can't get out of the bed and get to the toilet. Too bad.
That's not
Get
medical.
someone help. Yeah, it's not medical, right? So, but these are why people have so much confusion and they think that Medicare is going to cover it, but it doesn't. All right. So, if you're in that situation where you had a stroke in the hospital, you're recovered from the stroke, but you come home now and you're hemiplegic, half of your body, you're paralyzed. Okay, well, you've already been taken care of to the max for your medical treatment in the hospital. You've been through the skilled nursing home. Now you come home. You're half paralyzed. Well, you're going to need. How are you going to get up and get to the bathroom? Right? You got to take care of that yourself. Medicare's not taking care of that.
And neither is a Med-Sup policy because
No.
it only takes care of what Medicare...
There you go. That's
Yeah.
right. It's only covering your out-of-pocket costs under Medicare. So if someone had long-term care policy,
That's what it does.
okay, that's where this comes in. Because if you don't have a family member or someone that could help you with this, you need to hire and pay it out of pocket. And that's where the long-term care policy is going to come in to cover for many of those situations. And I see it every day, Michael.
Yeah.
Every day, Nadia. Every day.
Yeah, and one of the things that we always hear from our long-term care experts, and I hear
Yeah.
it out on, when I'm doing my speaking, is that so many people are still also under the misnomer that long-term care insurance is nursing home insurance, where in fact it's anti-nursing home insurance.
Yeah, it's not nursing home. It's not nursing home. I mean, I could break my leg from my femur all the way down to my ankle. And if I'm unable to walk and I can't take care of myself, I have long-term care insurance, I can utilize it. Okay? It's for those reasons. It doesn't mean you have to be in a nursing home. It's for a situation where you're unable to take care of yourself, unable to transport myself from the bed to the toilet, get myself dressed. Okay, I can't get in the bathtub. You know, your daily
transport
activity.
yourself.
Yeah, okay. That's what it's for.
And there's always that sensitive subject that always, the first time Mark Goldberg brought up, and I'm going to be introducing you to Mark so you guys can do other things with each other, when he brought up the statistics of the caregivers getting so sick and sometimes predeceasing the people they were caring from because of the stress.
It's so
but
much
again, they
stress.
didn't have the coverage. They didn't have the insurance, you know, to say, you know, so giving dad a bath, giving mom a bath, taking them to the bathroom, feeding them, this is a lot of stress on the kids. Even when they have all the love and patience to do it, has a very big effect on their lives.
And it also is an increase if they're working on their sick time at work. I see a lot of those family members losing their jobs because they have to take so much time off to care for their family member. It's now interfering with their own work. Now they're losing their own income. These things happen all the time. You're just not prepared. You don't think about it.
A lot of these long-term care policies also will allow you to use that money for whatever reason, like to give it to your family members to take care of you and stuff like that. People don't realize that some of them are just lump sum, you know, monthly lump sum, and you can use it however you choose.
And there's tax advantages involved for caretakers for taking care of their loved ones. There's a lot of things that people aren't aware of, but a long-term care policy is certainly an excellent alternative.
Yeah, no doubt about it. And let's get. I always seem to get back into long-term care insurance, that and reverse mortgages.
Wrong show, right?
I happen to be obsessed with it.
Where's my water?
Yeah,
Okay, I just want everybody to notice, Michael has his drink, okay? Nadia doesn't have. She's the co-host. She doesn't even have a drink. Where the hell's my drink?
Yeah, I just,
okay.
You want some lemonade?
No, right now I don't, but I might in a little bit. I mean.
What do you think, this is fancy here?
Okay, and I just want everybody to know, this is Michael's book, A Gift from My Father. I read it because when he was on my podcast, I wanted him to tell me, and I read the book. It was a half-hour read. It was a phenomenal story about his father, who was from the greatest generation. He's a baby boomer, served in the war. What a fantastic book. It's a half-hour read, and I'm not a good reader, people. Okay, so take a look at it. You can get it on Amazon right now. Michael's in the process, I think, of switching publishers. But when
I don't think I ever told you this.
It's a great book.
Because I'm switching publishers, and right now it's one of the reasons why we haven't pushed the book on TV. I do get calls, Michael, the book, why is it there? You never mention it. I'm going to have a new publisher in the next month, and we'll be able to do that.
There you go.
But there are actually copies. It sells for $8.99. Oh, by the way, I'm raising the price to $9.99 with the new publisher.
Yeah.
There are copies on Amazon for $49. And
Really?
I want to meet whoever's buying this for $49. I really, really do. Because I got a bridge I want to sell you that is unbelievable. That just blew my mind, but thank you.
I loved it. It was
It's
great.
not deep, but it brings a smile to your face.
Absolutely did.
Well, let's get back to Medicaid, because time flies so quick. We're halfway done with the show. If I didn't look at my watch, I would say,
Thank you. Somebody, thank you for whoever called in.
Come back here.
Thank you very much.
No, come back here.
I appreciate it.
That was not only our producer.
That was very nice.
Yeah, that was not only our producer, but that is the founder and president of WeBeam TV, who runs this great station. And I knew as soon as you said that John was going to come from the control room. I'm surprised he didn't bring a hose. Yeah,
thank you very much.
Thank you, John. That's why John gets the big bucks. So back to Medicare.
Back to Medicare.
Let's talk about what you want people to know. Let's talk about getting them on your podcast, or at least listening to your podcast. We learned that there are a lot of choices. What's next? I mean, you deal with so many people.
Let me tell them about something that's going on right now that's very important, that I think that everybody should know about.
You take over for the next 25 minutes.
Over,
it's yours.
So, if you are on a prescription drug plan and original Medicare, and you are paying for that prescription drug plan through your Social Security, which means that the government is taking the premium out of your Social Security check each month. Social Security had a big faux pas, people, okay, and they didn't exactly specify what went wrong, but it was a huge boo-boo. And since February 1st, they stopped taking out the premiums out of your Social Security check, okay? So you haven't received a bill, and you all of a sudden had a larger amount of money in your Social Security check. And now you're getting letters from the carriers telling you that you owe them 2 to 3 month premiums for your Part D prescription drug plan. It is the truth, people. Social Security screwed up. All the carriers have supposed to have sent out letters to you. Okay, so you need to pay your carrier back the 2 to 3 months that Social Security failed to take the premiums out of your check, out of your Social Security, and you need to contact Social Security and tell them if you want it to continue to come out of your Social Security check. Most of my clients, Michael, I tell them to have it drawn out of their checking account. Not for this reason, but this was a great reason now. And I have so many of them calling me up saying, oh, thank God that wasn't me. Because the government is so slow, okay, and for having snafu pause like this, I tell people, let them draw the premium out of your checking account because it's quicker. I review my clients' plans every year, and I tell them to change to what's better for them for the next year. So in 2020, whatever plan is best for my clients, that's what they're going to be on. And I tell them, draw it out of your checking account because then we get it done like this. It's done, ready for the next month. We don't have any snafus, no problems. So if you do have a prescription drug plan where it's been coming out of your Social Security check, get in contact with your carrier. Please pay the bill because you're going to have to pay it. You have it's not likely, but it could happen. You could get dropped from the plan, okay? And then you're going to be in trouble. So call your carrier, pay the back balance, and then you have to call Social Security to get back on either through your Social Security withdrawal payment, but I advise you to do it out of your checking account. It'll be quick, easy, and painless.
And this won't happen, and that's very dangerous.
I know.
I guarantee you our listeners, or many of our listeners, are going, is that the way we pay? What's happening?
And they're probably pulling
need
out
to
their
check
bank
out right now.
statements right now going, what came in the last 3 months?
Has something like that ever happened before?
No, this is the first time this happened in this way, yeah.
That's amazing that this is the first time the government has goofed that up.
Oh, they goof everything up every day, but this one affects millions.
Oh, yeah, this is...
Millions of people.
And could carriers actually drop people when
yes,
they know
they can, but
the premiums...
You can fight it. Okay, I have hardly any clients that are having their prescription drug plan premiums taken out of their Social Security check, but the few that do, because listen, I know some of you out there are concerned about having something automatically taken out of your account. I get it. Believe me, you're worried about identity theft, and if that's you, no worries. Okay, but you are going to have to manually call them and have them take it out of your Social Security again. But the rest of you, have it taken out of your checking account.
All right, so that's
Will they bill you? Where you could just send in a check?
Well, they're going to bill the people right now. Social Security is going to send out automatic bills.
Normally, could you just send in a paper check?
You can, but then you risk, if you're late, they can drop you.
Yeah.
If you're late, they can drop you. Non-payment, they'll drop you. If a check automatically bounces, you didn't know because something didn't come in time, they could drop you.
Okay.
And you don't want that. You don't want that.
What's the next thing you want people to know?
Let's see, what's the next thing I want them to know? I want you to know that if you are on a Medicare Advantage plan here in Florida, over 60% of you are. Okay, really? Of all the plans, Medicare Advantage is the #1 plan, and an HMO, which is a health maintenance organization. It's the smallest network. It's usually by county. So if you're in Pasco County, you usually see your doctors and facilities in Pasco. If you're in Pinellas, you know, things like that. If you're unhappy with that plan, and you've in this locked-in period and you didn't have any other special elections you could think about, there are actually 2 5-star plans and a 5-star Medicare Advantage plan. You could change to that plan any time of the year. Okay, it's the top of the notch that CMS gives out to a plan each year or a few, and you have an open year access to get on that plan. So you could check out Care Plus, and you could check out also Blue Cross and find their 5-star plan, see if that plan might be better suited for you. And if it is, you're able to change to that plan, and no problem. You'll get instated for July 1st if you think that's a better plan for you. Make
so
sure
what does
your
that mean, 5-star? Does that mean like it's better coverage?
No, it's not better coverage. Benefits are the same. It doesn't matter what carrier. They all have the same benefits of Medicare, right?
Okay.
The difference is the costs, your out-of-pocket costs. Your co-pays, your deductibles, and your co-insurance. That's what the difference is. And some of them will add supplemental benefits for the competition. Okay, so you'll have plans that'll add some dental, because dental is not part of Medicare. Eyeglasses are not part of Medicare, and neither are hearing aids. Okay, in 1965, we must have had a very young Congress because they never thought about having to wear glasses, teeth, or hearing aids, right?
Not the sign now. The average age of a congressperson is like 103.
Exactly, but back then they didn't think about it, so they never introduced it into Medicare. So some of these Medicare Advantage plans will add dental. They'll add offering up to $300 towards eyeglasses, or you could get a hearing aid and they'll give you a voucher, with $300 towards that. So each of them try to finagle their way to compete with each other to get your business. So those are added different types of supplemental benefits that could be available to you. But the benefits are exactly the same. The benefits of Medicare. They have to follow the same rules, right?
Yeah.
So
I meant cost-wise.
Cost is what's different on every single plan, including Medicare supplements. So you were talking about Medicare supplements. I mean, there has to be over 50 different carriers.
Wow, I had no idea.
Oh, yeah, in Florida, in the county that you could have if you wanted to go on a Medicare supplement plan. So let's say supplement plan F as in Frank, which is the most comprehensive plan. It pays all of your out-of-pocket medically necessary costs for Medicare, co-insurance, deductibles, co-pays for the monthly premium. And let's say, you're turning 65. A woman that's turning 65 in Hillsborough County right now can get a plan for under $180.
Really?
But there will be the other 49 carriers that will charge up to $280 a month for the same exact benefits. Exact.
Well, then why would anybody sign up for the other ones?
Because they don't know that you need to do your due diligence and find out what your out-of-pocket cost per month for that premium would be. They don't know. If you call an agent, let's just say from the Acme company, right, and they come to your home and that's the only product they can offer you, they're not going to tell you you could get a plan for under $180
when
for the same.
$280.
Exactly, because they got to feed their family, right? You need to have a independent agent, okay, a person like myself, a Medicare expert, a Medicare specialist, okay, who offer all the plans to people so that I can help them find the plan that fits them. I don't have any agenda. I'm not aligned with these insurance companies. You've been hearing me talking, all right? I can't stand insurance, okay? I'm for my clients. I'm to find what's best for them. So you have to look, because cost is so different by zip code. By zip code. And many towns and cities have 5 different zip codes.
Are you kidding? Yeah, absolutely.
So you could be across the street. You're in a different zip code. You could be paying $20 more than your neighbor.
I just switched auto insurance. 1 mile away, I moved, and my auto insurance went up $311 for 6 months.
$311?
Yeah, 3 cars.
6 months?
3
Wow.
cars. Yeah, $311 increased for a 6-month period.
It's $52 a month because you
for
moved?
1 mile away from Palm Harbor to
zip
Turpin.
code, it's all about risk, right? So
Can you
that
believe
area,
that?
So there
that
were
area
more,
is
so
she in it.
statistically,
It's more
there's
in
more
Turpin.
accidents.
More accidents
in
or
the-
more
in your
crime.
or more crime. Oh, I never thought about that. That's right.
Vandalism,
Wow.
stolen vehicles.
I
That's
was so mad.
That's
I
amazing.
dropped 1 car because my daughter finally got her job, and I was all excited. She finally came off my insurance. And it was like, oh, well, sorry, now you have a $311 increase. I'm like, well, I'm back to square one
Yeah, it
again.
never stops.
Yeah.
Okay, if someone is financially able, money neutral, should they be getting their Medicare and their Medicare supplemental policy immediately together? I don't mean the same day, but
No, I
I'm
understand what you're saying.
65.
Yeah.
Time to do them both if I can.
If you want peace of mind and you do not want to have to worry about where you're going to go, you have cancer in your family and you have a high risk of getting cancer. In my family, I have a high risk.
Yes, so do we.
I mean, my sister has cancer, my father's sister, my father's grandmother, my grandfather, a lot of people had cancer in my family. So I want that peace of mind. If I'm financially able and I'm turning
Get it.
65, I want my original Medicare and I want a supplement. Because I want to know that if I want to go back to Sloan Kettering in New York, I just got to get there and they're going to treat me and I don't got to pay for it.
That makes a lot of sense.
So if you're financially able, a supplement is an excellent, excellent, excellent way to go.
Now, is
So you
there
don't have to worry.
underwriting with the supplements?
Not when you're turning 65.
So there's the other advantage.
That's an excellent advantage. So the 3 of us could be going to be 65 tomorrow, okay? Michael, you could be the healthiest one in the bunch. You're running like crazy out there. Your pulse is like 60. Your blood pressure is like 118 over like 68, okay? You could have type 1 diabetes, okay, with insulin, and I could have 3 stents. We could all go tomorrow and we could sign up for the same insurance supplement under the same carrier. And there's no
Same
discrimination.
premium?
Same premium. No discrimination
With the
whatsoever.
supplemental policy.
With a supplemental policy, yeah.
Now,
mean,
the
that
minute
sounds
you
great.
wait till after 65, then there is underwriting, correct?
There is. Okay, so it's going to be when you're turning 66, it's going to be a year after you're turning 65, that a Medicare supplement, because again, they're not part of Medicare, right? It's a carrier.
So you have a year.
You do. You have a whole year that you could change.
That's really kind of amazing. That no wonder they don't want people knowing that. That's the first I've ever heard that.
Yeah.
Because it is amazing for the consumer, but that's a hell of a
Now,
risk
if you're
for the
on
insurance
if you
company.
decide to go on a Medicare Advantage when you're turning 65, and you've been on it, and you really didn't know about Medicare supplements, and then all of a sudden you start hearing about it because maybe you're watching the show, maybe you got on my website, wherever you heard of it, okay, and you said, oh my God, I really want to be on. I want a Medicare supplement. Well, you could change from your Medicare Advantage if you did not make any changes from that original day to a supplement, and you won't have underwriting because you had that 1 year of like a free look. So you
That's
could go
interesting.
on.
At
a
age
Medicare
66.
But
But
after that, that's it.
All bets
there
are
will be
off.
all bets are off,
Now
and
you
the
have
price will
underwriting.
change because you're older. And if you have any health problems, let's say you do have stents and you're taking medications for cardiovascular disease, they can decline you right out, flat out.
No declining at between 65 and 66?
Nope.
Oh, I need to put that on my calendar like for 4 years from
Yeah,
now.
yeah.
no kidding.
No fooling around.
really.
Seriously,
There's no- they will not- they
seriously.
cannot
For
decline
you,
you.
you should do the Medicare
Yeah,
plus the
because I'm falling
supplement.
apart as we sit here.
He really is. No, I'm just kidding.
So the
People
biggest
think
thing I hate in Medicare is I can't stand Big Farm and how they're just messing with all of us with prescription drugs.
Yeah, that's...
Okay, and this is across the board.
ridiculous.
It's
Yes.
on Medicare or not. Okay, but I want to let you know that if you you are on Medicare and you're taking prescription drugs, you don't have to settle for paying for these high prices. Okay, for certain medications, I can't help you. You might not be able to get certain help for certain medications, but for common medications that are costing people over $100, between $100 and $300, there are options. And number one, I would tell you to try the discount pharmacies online, like GoodRx.com. I have no affiliation with them. I don't
I've
get
used them
paid
to
by
find stuff.
them.
That's
Okay, I'm
unbelievable.
just talking about a good resource, all right? You can go on that website, you type in your zip code, you type in the medication you're taking and the dosage. It will tell you the cash price at your local pharmacies, and every single one of them are going to be different. And there's a good chance that that price could be cheaper than what you need to pay on your plan.
Yeah.
The second option...
Was that goodrx.com?
Yes,
yeah,
good.
it really is incredible.
RX. It's excellent. And there are several different ones. I just use that one a lot. The second thing is that there's also Canadian Meds outlets out there now. They're independent owned operators that do business directly with pharmaceutical companies from Canada, London, India, and Israel.
Is there a worry, though, I see this, on certain things, isn't there a worry with the Canadian medicine, regardless of where they're getting it, what country, that it could be not what it's supposed to be? Not that it's necessarily bad, but it's not the quality that we're used to.
Michael, let me tell you something about our own United States prescriptions.
Yeah, I can-
Do you know where 99% of the fillers are made in our medication?
I'm afraid to ask, but go ahead.
China.
Really?
And are you going to trust that China's putting in the exact ingredients that are supposed to be in our medication?
I don't even trust them to put it in my beef and broccoli.
And they do
All right.
have, and the generics have a variance. I used to be I know.
Yes. Okay.
They have a variance.
So,
I believe I used to know this, I don't remember. It's like a 15% variance of what the actual medication is, and as long as it comes within, is 15%?
yeah, it's a
right?
range. I'm telling
Yeah,
you,
it's a range,
sickening.
like 10 to 15%. If
That's
the generic
dangerous when you
only
think-
Okay,
has-
so there you go.
right,
So we're worrying about Canada.
Yeah,
We're
really.
going to worry
Yeah.
about London and Israel. And I mean, we're
I'm
getting our
worried
own
about Israel.
medications,
Yeah.
okay, from China. A
Right.
lot of the fillers in our medications. So the companies that they're working with are highly respectable. And yes, could they have fillers that come from China? Well, they could too. Okay, but you're going to know, they're going to tell you, they're very transparent, and the prices are ridiculously less
Yeah.
than we pay.
The dishonesty in the pharmaceutical companies,
It
we
is.
could have an 8-hour show about that, because
please.
I think this is at least one thing that people on all sides of both aisles, everybody seems to agree on this, but nobody does anything about it. That's what's also, and I know they're lobbying
Yeah,
power,
yeah.
and
Huge.
things such as that, but I just went off of Cobra after
Yes.
18 months on May 1st and went into Florida Blue. the amount of the premium. I'm not going to say
You don't
on
have to.
air.
We know it's outrageous.
Yeah, it's a house payment, and and hey, but in my shape, you got to keep your major medical insurance. But there was about 10-day period where I was approved, but it wasn't in the system yet. So I went to get my Trilogy. Trilogy is a squirt thing that you take for some lung problems that I take every morning, and I needed it. I was out. So I went to my favorite pharmacist. We won't name that either because I love them. And I said, I need the Trilogy. So they look on the computer and I say, Florida Blue. They go, you're not up yet. I go, well, I need it. So I go, okay, I'll just pay out of pocket. And he looks at me and goes, $626.
Wow.
I go, it's always like 26. He goes, yeah, that's with insurance. And then when you let that, and I didn't buy it, but I made sure I was on the computer the next day.
That's right.
And then it was $6. I couldn't believe that. I went down with the one I had to the one I have now. I paid $6, and the day before they wanted to take $6.26. Now I'm not blaming CVS for that. They got to complain, CVS or
whoever it is.
Walgreens.
Yeah.
I'm not complaining about that drugstore because they're only taking from me what's on the computer screen,
Right.
what they have to do. But the dishonesty in this being $6 one day and $626 the next day is just staggering if you think about it.
Well, Michael, for our whole life, I'm going to tell you how deceitful and dishonest the pharmaceutical industry has been our whole life. If you were on insurance and you went to the drugstore and your copayment was $25 for the medication for 30 days, you paid your $25, whether that drug cost $4
Or not.
to make.
Yeah.
You paid $25 because that's what your contract says. And the pharmaceutical benefit managers who negotiate those contracts between the pharmaceutical company and the pharmacy had a gag clause in the contract that not one employee from the pharmacy could tell the customer that, didn't you know it's only $4? You should be paying $4 instead of $25. So our whole life we've been paying more money. Okay, and it just this past year in 2018 that they passed a law, no more. Somebody finally was the squeaky wheel, and we got it passed in all 50 states that they can't do that anymore. So I'm telling you, if your payment for your co-payment on your plan is $10, ask what the cash price is, because if it's $4, pay the $4 and do not give them your Medicare card.
It's funny, I didn't know anything about the new law, like you just said, but I was just going to say to you, a couple of years ago, and I won't name the pharmacy because I don't want to get them in trouble, but I came in for some stuff, and they looked at me and said, we ran a few of these through your insurance company, but these 3 we're not going to, just pay out of pocket. And I like these people, but my normal reaction was, I don't pay out of pocket, run it through the insurance company. And I was being, I guess, kind of dense, and he went, no. You don't want to do that. And I go, yes, I do. That's why I pay these big premiums.
Yeah.
And he went, Michael, listen to me. I know you for a long time. These 3 you're not putting through your insurance. And then suddenly it struck me. I was being very dense.
Yeah. You were dense. That's what we're used to.
Yeah. And when he showed me the bill, I went, well, how can it be more expensive with insurance? And
Now you know why.
Actually, this was a very nice young lady pharmacist who said, I don't have 3 years to explain this to you, but trust me, the next time I tell you, we're doing that. But that hasn't happened in a while. When did that law happen?
In 2018.
You think it's still happening anywhere?
Well, I do, probably, because think about it, they've been under this gag order for so long. So I always tell my clients, you have to be your own advocate now. That's our new world, right? You have to be your own best advocate, because no longer are the days where you can take the word of your healthcare provider and it's golden, right? You have to ask questions, you have to advocate. So always ask what the cash price is, just to make sure. And if it's cheaper, just take your prescription drug card, your Medicare Advantage card, put that away, and just pay the cash. That's it.
You know how much money? It can't even be millions. It has to be hundreds of millions of dollars.
Billions.
That was spent before that law was.
Trillions now. Now you're going to go way back, trillions.
Wow.
I don't even know what comes after that.
Yeah, think about like the cheap antibiotics
Zillions.
you can get. You're paying $25 and you could probably get them for $4.
Yeah. Cheap, zero. Some of them are zero.
John, you read my mind. That was you, John, right? That wasn't a voice in my head, right? That was you, John, yes.
I thought I had the alter ego tonight.
Yeah.
You got an alter ego going on?
I have all sorts of things going. Be quiet. Not now. Okay. No, John just said, as I was thinking it, which was kind of amazing, and I'm plugging a company here, but I have to. Publix is very well known for doing things for $4.
Yes.
The drugstores do for $38, $92, $4. I mean, my God.
Yeah, so most of the pharmacies now have a program for cheaper prescriptions. Publix got the $4 program. Walgreens had a $4 program. Some of the others you could pay $18 annual fee for the
Walmart,
year.
I think, had something
has one.
similar.
So there's a lot of ways that people are able to have a program that can help them with cheaper medications.
People have to start learning, like you said, to be their own advocates, and they're not used to that.
They have to, I know.
And the older generation, which I'm now becoming, we're less used to it because I got to tell you, God, I hate dating myself like this, but my doctor, when I was a kid, made house calls, and he delivered my sister and myself, and you know, and you trusted him implicitly.
That's right.
And your pharmacy, I can't go back long enough to remember when they were doing this with the, making the drugs. I don't go that far back, but you trusted your pharmacy. He was second to your doctor when he said, "Wait a minute, let's take a look at this. I'm not sure you should be doing this." It's really staggering today how far we've come, but it's equally as staggering how much we have lost ethically and morally. And we could do a whole, I won't even say a whole show, we could do a year's worth.
Season.
Yeah, a whole season of that. And it's just wrong. It really is. So we only have about 5 minutes left. I hate this because the hour goes
flying.
by.
I don't even
well, that's
know.
why you're going to come back.
We're flying.
But your website is right behind us. Tell us, no, you don't have to do that. They're not seeing that.
They're not?
No, it's on their screen. When did you start working here?
I don't know.
I don't know. Nadia, what's the matter with you? Your website is up on their screen. What is the easiest way?
TheMedicareNation.com.
Okay.
TheMedicareNation.com.
And you got to listen to the podcast. And I'm not talking about mine with reverse mortgages on it.
I do listen to it. It is very good.
Yeah, oh, thank you.
I have over 100 episodes, all types of topics with Medicare. I have fantastic guests from the biggest, awesome nonprofits in the world, like the National Kidney Foundation, the National Optometrist Association, the oh my God, there was so many. It's just wonderful, all the different resources. Cancer Association, it's wonderful.
Since we were introduced, I can't say I've listened to all 100, but I've listened to at least a dozen of them, quite frankly. And, a lot of podcasts, you have to be specifically interested in what they're saying to keep listening. Or at least you have, I won't say interested, you have to be directly, like my aunt needs this. I better listen to this. My cousin Bill may be interested. I got to tell you that of the dozen I watched of yours, most of it, I had no family members, no anything, but they're very good guests, and you ask the right questions, so you're learning stuff and just sitting there going, yeah, wow. And then suddenly it's over, too. There's a lot of times I listen to a podcast and I go, I guess I should keep watching or listening, but man, when is this thing going to end? But maybe something good's coming. Yours are kind of short. What is your average podcast?
When I'm just doing solo, it's usually about 30 to 40 minutes. With a guest, it's about 45 minutes to an hour.
It goes quick. Ours went quick.
Ours went really quick.
How long was ours? I thought it was...
I think ours was 40 to 45 minutes.
Really? See, if you would have asked me before you just said that, I would have said 20 minutes.
Really?
Damn, I can talk.
Yeah, you can talk. You talk, okay?
I'll vouch for you.
Hey. Can't trust anybody.
But they can listen. They can listen to the podcast on any of their phones. If you got an iPhone, you got your purple icon with the purple white microphone. You just tap on that and just type in the word Medicare. Believe me, it's going to come right up. It's the #1 show on Medicare in the world. And then you could also, send me an email to support@themedicarenation.com. I'm happy to answer any question you have. If it's a paragraph or less, people, I do all my answering my emails myself because I want to make sure it's right. I want to make sure it's right. Yeah, so as long as I can answer in a paragraph, I'm happy to answer.
What's going to happen, though, when you have millions of people coming? You're going to have to hire staff.
I'm still going to answer those emails because I promised everybody I would do it. I would do it.
You do like to protect and serve, don't you?
What are you going to do?
We got a guy. I can't believe how quick this went by. How long, John? Long John. Okay, we only have 1 minute left. Thank you so much for being here. Please promise you're going to come back.
Oh, I promise.
Okay, very good.
Come back. John's going to have water.
I'll make sure and get her water this time.
Some water. Okay.
Never
Some
stops.
water.
With less than a minute to go, we have some great shows lined up. We keep always coming back to this type of thing, Medicare supplements, Medicare, long-term care insurance, reverse mortgages. And if any of you are following our website, you saw some major changes since the beginning of this year. More major changes are coming in the next 90 days as we transition from just 62 Who Knew to 62 Who Knew, the longevity initiative. We are going to be joining the podcasting world on a national level, and you will be able to go to our website to contact professionals like this and actually purchase the products that we speak about. We didn't think we were going to do that 41 weeks ago. We thought we would be pure education. But people are going, okay, we're learning great things.
Now where do we go?
Now we're still with Phil, our next door neighbor.
You're right, Phil, with
So
those
we are
Band-Aids.
literally turning the longevity initiative here, 62 Who Knew, into a site where our visitors can go to, learn about professionals like yourself, and then click and contact you and purchase these services. 20 seconds left to go. Thank you so much. Thank you as always.
Thank you.
We got some great stuff happening in the next few months. Watch for the changes in the website. Wide camera. 41 weeks. I still look at the wrong camera. This could be why I'm not on national TV. Thank you very, very much. As always, 62 Who Knew. Thank you.